This is the text that I would receive if I tested positive. And this text will come to me shortly after the information gets into the Department of Public Health and the California system. So if you see from the text here, it is both in English and in Spanish. So all of the information that we are going to go through in English is also available in Spanish. So it's important to note that, but we will be looking at it in English. So if we click on the link, if I click on this link, I'm taken to this initial page. I'm going to walk us through what I would see and how to respond. So when I test positive for COVID-19, the laboratory by law is required to report that result to the state and then to us in our health department in San Francisco if I'm a San Francisco resident. I gave my phone number correctly at the time of my test, and that's how I can get my result, and that's how I can get this information. Now, I'm not simply going to get a text that says you've got COVID-19. The virtual assistant is going to verify my identity in the next phase. But it's important to see that information at the beginning, that people get awareness that the information is confidential and that we never ask for immigration status, credit card number, social security, any of those types of information. So here I am at the page where I am confirming that I am who I say I am. So my zip code is being entered, and then I'm entering my date of birth here as well. And if it's a match, it finds my result, and then it starts in the process of informing me of what I should do. Now, the first thing that comes up is around isolation, staying away from other people, so I do not inadvertently spread COVID to anyone else. This is one of the primary things that we want people to understand and to do. So it comes up very early in this questionnaire. This tells me that I've tested positive for COVID-19 and that I need to isolate. Now, I may not know what isolation means, so there are instructions in very clear language that anyone can understand that are built into this virtual assistant system. So you can just see them there. Okay, and so then the question it asked me are, am I able to self-isolate at home? Reading just now what that entails, can I do that? So I just want to say that if I were to say, no, I am not able to self-isolate at home, I do not have a space where I can be apart from others in my household, and I click that button, we won't click it now, but if I click that button, that prompts a notification to the team, the case investigation and contact tracing team, to call me as soon as possible. So anyone who receives this can get assistance from our team just by clicking, no, I'm not able to self-isolate. That's an important note to keep in mind. But I'm going to say, yes, I am able to self-isolate at home, and go to the next set of questions. So it says, great, it registers the information I gave it and says, oh, that's great that you can self-isolate. And it says, we want to know how is your health and are you having any symptoms? So it's going to ask me about the symptoms that I may have had. And if I click on the drop-down menu, it will show me some symptoms that have been associated with COVID-19. So I'm going to say that, yes, I've had a cough and I've had a headache. Those have been the symptoms I've had, and I click OK. And then I can hit continue. Those are all the symptoms that I've had. Okay, it's going to ask me, when did these symptoms start? So I'm going to open the calendar there and say that my symptoms started on the 23rd, on Monday. That's when I started noticing those symptoms, and then I can continue. Using that information that I just put in, the system is going to calculate back to the starting period where I first became contagious to others. And that's really important, because then that's the time period I'm going to try to think through, okay, where was I and who was I with during that period? So based on my symptoms starting on November 23rd, 2 days before that is when I started becoming infectious, on November 21st. So that's really important to keep in mind. And the system calculates that based on my input. So it's going to then ask about where I've been and some of the people that I've been around. So again, to try and get ahead of the pandemic and to prevent outbreaks. Schools are critically important, and those are called out specifically because we want to know, was I connected in any way to a school while I was infectious? So it's going to ask me, was I a student? Was I staff or faculty, or did I volunteer? Well, no, I wasn't connected to a school during this period, so I answer no. And then it's going to say, since November 21st, Was I a close contact to any other people? Was I less than 6 feet away in any of these places? It's going to ask about some places I may have been. Did I travel by air? It's going to ask about childcare or preschool. I won't list all of them here, but you can see concerts, gym or salons or other businesses, or a party or gathering of 5 or 4 people. I was at a party, and so I'm going to say yes in this instance, for this example. And it's going to then ask me if there are people around me that have been, again, close contacts. The definition is built in here, so people don't have to know that ahead of time. So it's anyone who is within 6 feet of me since November 21st, my period where I became contagious, for 15 minutes or more. These are my close contacts. Have I had any since November 21st? And the answer is yes, I have. Okay, this part is really important. We are asking people to share with us the names and the contact information, the mobile number of their close contacts if they have them. And this allows us to reach out to those people and support them just the way that you just saw that I was supported to make sure I could isolate. We want to make sure that those people can also stay away from others. For contacts, it's called quarantine. So we want them to be able to quarantine for a period of 14 days. And so that's the reason that we're asking for this information. It really, again, is to break this chain of transmission. So it's asking me and telling me that the information is going to be confidential. By law, we are not telling people who or where they may have been exposed. So for instance, if I put in my contacts information, the system or our team is never going to tell someone, you know what, it was Susan Phillip that was the person that tested positive that you were exposed to. We never do that for any condition, and that's been true throughout public health in California and in San Francisco. And so, yes, we want people to say, yes, we'll share contact information. And then it's going to ask about the contact. So we're going to try to think through. Hopefully it hasn't been a lot of people that I have been around, because we're reminding people about limiting our exposure. But I'm going to just say that I was I had a close contact that was Jane Doe. And here is this person's phone number. Okay, so that's the most critical information, and putting in the exposure date. So again, with the calendar, I was at a party on November 22nd. That gathering I talked about was on November 22nd. So I go ahead and put that in there. And what kind of contact is Jane to me? Is this a workplace or someone in my household? Well, this was a close friend. This was at that gathering. And so I'm going to say that that was the relationship. And it asks for age. If you know it, that's fine. Otherwise, you can continue. All right, so the system is then going to switch back to asking me about where I might have become exposed or infected if I know that information. So again, it's trying to understand the networks and how the virus is spreading. It's going to say, you know, did I have a close contact that was positive, or did I not have a close contact? I'm going to say, I don't know. I mean, maybe someone I was around was positive, but I don't know if that were the case. So I hit continue. It's going to ask me for a little more information about myself. And again, the reason for this is really just to have additional ways of finding me if needed, or to have additional information. So you can enter these fields for yourself. I can enter these fields if I want to. And if I don't feel I want to, I think the most important thing is sharing your contacts and sharing if you've been in certain key sites like schools. This last set of questions, these last fields are really important. And so we would ask everyone to answer these. These are demographic questions, and we want to understand for all the people that test positive, which communities are they part of? The reason for that is that we will then work and change our focus to shift resources, shift support, and provide more directed, culturally connected services to the communities that need them the most. So we need to understand where this pandemic is shifting in San Francisco. As we said, it's becoming more widespread over the past month as we've had the surge, and we really want to understand what's happening. So you'll see a whole list. There's a whole list of drop-down questions that people can answer.